You know, it seems like everybody's got an opinion when it comes to these vaccine mandates. And tonight, that includes the U.S. Supreme Court. The High Court blocked part of the federal mandate that required 80 million Americans working at large private companies to either get the vaccine or get tested on a regular basis. Justices argue that OSHA, which is the group who'd essentially enforce the mandate, does not have the power to regulate public health. But today's ruling gave the green light for those same vaccine requirements to continue at hospitals across our country. Emily Longnecker kicks off tonight's big story, explaining why today's decision does not make a difference for a lot of healthcare workers here in central Indiana.
Thursday's decision by the Supreme Court doesn't extend to most health care workers. This past year, all three health systems in Indianapolis put vaccine mandates in place for their employees, and those mandates stand. In June, IU Health announced workers had until September 1st to be fully vaccinated and could apply for an exemption based on religious or medical reasons. The move brought some protests and petitions. By the deadline, IU Health says 125 employees left because of the mandate. 61 of them were full-time. Community Health issued the same directive. As of this past September, 99.6% of employees were either vaccinated or had an exemption. Eskenazi's mandate hit September 20th, with 39 employees deciding not to get the vaccine. The Indiana Hospital Association issued a statement after today's decision, emphasizing the importance of the vaccine in protecting healthcare workers and patients, and said this ruling gives them a clear path forward as Indiana hospitals battle the highest number of COVID-19 hospitalizations on record. Indiana Republican Senator Mike Braun also weighed in after voting last month to overturn the mandate, calling it, quote, unconstitutional and wrong. He said today's ruling is a win for the liberties and livelihoods of millions of Americans.
We also heard from Governor Eric Holcomb tonight, who says the vaccine is the #1 tool to protect against the pandemic. But he argues it's not the state or federal government's role to issue vaccine mandates on businesses.
Right now, the lawmakers here in Indiana are considering a bill that would limit those vaccine mandates at work. If companies decide to still implement their own requirement, House Bill 1001 expands the employee exemptions to include natural immunity, along with medical and religious reasons as well. Workers then can either prove they had COVID and recovered, or they can provide an antibody test. Now, if businesses offer a testing alternative to the vaccine, the bill would make the company pay for employee COVID tests. However, those businesses can get some help from the state to cover the cost. This bill just left the committee last week. It's being voted on in the House.